Hey guys, Kobe here from soothclinic.com, Osteopath. Yes, I attempted to do my second YouTube live an hour ago and it was a disaster, technical issues, so huge apologies. So I thought I would just do this again now because it's such an important subject, disc injuries, and I know a lot of you will have been looking forward to this. So here we are. So just here to answer your Q&As on disc injuries. Obviously, it's a massive problem affecting up to 50% of the population in the UK, and it's worldwide. And it's a terribly distressing condition, a disc bulge, because it can cause excruciating pain. And the advice that you take and what you do really does. Let me just check the audio. I'm supposed to check the audio. There we go. Yep, audio is great. Okay, fabulous. Bring my questions up. So yeah, what you do in the first kind of 2 or 3 weeks of a disc bulge really matter. So let's move straight on to the questions, shall we? First one, here we go. About 6 months ago, I did a stiff leg deadlift. That's a weightlifting move for hamstrings. And since then, I've had a really bad discomfort in my lower back. I eased off training for a few weeks, which was recommended by my GP, but it didn't fully heal. It then worsened a few months later, and I'm now unable to train. Did an X-ray, and it showed an imbalance in my hip, which has made my right leg seem longer. Recently, this is the interesting bit, the stiffness has worsened and made my GP prescribe me diazepam. Without it, I am unable to sleep at night due to the pain. The diazepam is helping until my MRI in 4 weeks' time. Please give me some tips and treatment that I could get. So here we have the subject of weightlifting, and I might just start this by saying anything I say is my own opinion. Coby Langford, Osteopath. It doesn't necessarily represent my profession's opinion. It's just me and my own experience, 17 years of working with disc injuries. So in my opinion, weightlifting is very dangerous for the discs if it's done incorrectly. Or do they call it correct form or bad form? So the thing about weightlifting that I observe is you're just focusing on the muscles that you're trying to strengthen. And indeed, the movements that you do, such as the deadlift, are very good for strengthening muscles. But what you don't necessarily think about when you're doing these lifts is the structures underneath the muscles, and in particular your spine and your discs. So the first thing to understand is that your discs are incredibly strong. When I was at university, we used to work on cadavers, and we would look at the discs, and we were taught that experiments done on cadavers, dead bodies, show that the disc in central position compression can take the weight of a small mini, an actual car, without damage when held in the central position. So that means when your spine is straight. Now, when your spine comes out of that central position, the discs are very weak because as a full structure, they're very strong. But once your weight is out of that central position, that's when you start getting these little tears and just little strains. Initially, it's just a strain, and then you restrain, and then you kind of get a weakening through the same area of the disc until the disc eventually splits. And as you know, a disc bulge is just when the disc is split, but the surface of the disc is not breached, so it can hit a nerve or not, and you just get that pain as long as that disc is hitting on the nerve. So deadlifts in particular, they just make my eyes water when I watch them because all I can think of is the discs. So I'm just going to bring you up a little bit. For those of you that don't know what a deadlift is, where am I? Oh, yes, right, let's just bring this up. So this is a good lift. This is how we like you to lift. We like you to lift with the load close to your body and all the weight going centrally down through your body. And in that position, if you lift in that position, there will be no injury, most likely, to your discs. A bad lift is like this. So the minute you can see that the spine is held forward there, and all the strain, it's just mechanics, all the strain goes through the spine there, a couple of joints there, and in particular through the discs. And if you do that enough, you start damaging and weakening the discs. Discs don't just suddenly get damaged. It happens over time. You know, people often say to me, I was just picking up a piece of paper, or I was just tying my shoelaces, but it's not that. It's the years and years and years. You know, disc injuries are common in like 30 to 50-year-olds because you've had like 10 or 20 years previously of maybe poor posture, lifting incorrectly, sitting a lot of flying, you know, all these kind of things, a lot of weightlifting. So you've seen that position there, and let's look at a deadlift. This is the position. This is obviously a bad deadlift because I know you're taught to do deadlifts with the spine straight. But if you see this is the deadlift. So as an osteopath, basically the disc is not protected in this position at all. That, you know, even if you contract your core, you know, it's really hard to protect your discs in that position. So what I'm saying is I'm not criticizing weightlifting. I'm just saying you need to take a lot of care when you do them. So to answer your question, it does sound like you have a disc bulge. So with a disc bulge, my advice is to completely avoid any form of weightlifting, because anything you do with a torn disc is going to aggravate that disc. And the number one, some people have disc bulges so bad that they can't even lift a kettle, let alone weights. So if you're going to weightlift, I prefer low weight, high rep. I believe personally that you can get the effect that you want through those muscles with low weight, high rep. So that would be my advice. If you have a disc injury, avoid high weights altogether. And remembering that once a disc, we'll come on to that later. So so I hope that helps. I have a friend called Radha Patel who has a YouTube channel as well, and she's a personal trainer, and we are going to be doing some videos on how to train safely without injuring your back or your discs. So look out for those. I'll let you know when they come on. Right. Next question. I've been recovering for 7 months from 3 bulging discs. I'm sorry. That's horrible. With only 2 hours of sport a week, I've been told no physiotherapy is needed, but I'm still in excruciating pain, and that pain hasn't moved down from my leg, but the back pain is 24/7. Any tips? Okay, so the thing you have to remember about a disc is even though you're not in any pain, it doesn't mean the disc is healed. The disc is like, you've got to think of it like a broken bone. You know, the disc, it tears, it bulges, it hits the nerve. Then, within a couple of weeks, the disc comes off, it moves back into that centralized position if you've taken the right course of action. And so you're pain-free. So you think that it's all better and it's all healed and you go back to life as normal. But that is actually the most dangerous time of your disc healing, because you're not in any pain, but that disc is still torn and it's not yet healed. You need at least 6 weeks minimum for a disc to heal, and obviously everyone's disc recovery speed is different, completely dependent on how bad the bulge is, how bad the tear is, how long it's taken to get there, but mainly dependent on what you are doing. Because if you are continuing to sit for long periods of time, if you're continuing to lift heavy weights and do all these contraindicated activities, you will basically be stopping that disc healing, because the disc needs to be, the tissues need to be close together in order to heal and form that scar tissue that actually strengthens the disc. I think a disc can be stronger after a disc bulge because it heals and the scar tissue forms. But what the majority of people do is they don't give the disc a chance to heal in the first place, and then you just find that it happens again. You get that leg pain again, and it's rebulged. Now the danger here is that each time it rebulges, it's a little bit worse, because obviously you're re-injuring the same tissue. And so why am I saying this? Well, basically in this question here, you're doing 2 hours of sport a week. So you may find that even though you think that's not a lot, For your disc, that's quite a lot of activity, and obviously it depends what sports you're doing. If you're doing something like tennis, which is, rotation, that is, the worst movement for the disc, for a damaged disc, is the rotation. So if you're playing something like tennis or squash or cricket or golf, which is highly possible, then you're just not letting your disc heal, which is why you're still in a lot of back pain, because even if your disc is off the nerve, the back muscles are still spasming to stabilize your disc. So I'm afraid I would advise you to lay off the sport. Unfortunately, the only way to heal a disc is to rest it and not put strain through it, and to strengthen your core and to strengthen your back. You can do that with my 6-week exercise program, the back muscle balancing, strengthening program, core reactivation. So that would be my suggestion to you. I know it's not what you want to hear, and a lot of my patients do decide that they don't want to stop these activities and give the disc time to heal. They want to just carry on, and this is kind of agreement that they'll just come see me regularly and maintain the disc. It's not my preferred method of treatment. I prefer that you just take a break, but lots of people can't do that. So it's entirely up to you. My advice is to stop anything other than swimming. Swimming is great. Swimming, gentle yoga, keep that back mobile, keep it stretched out, and start my 6-week strengthening program. Okay, best of luck with that. Okay, third question. I am in my 6th week of healing from a posterior herniation. Now, 6 weeks is not long. You're basically just about pain-free, but most likely not healed yet. So I'm in the 6th week of healing from a posterior disc herniation at L4 and L5. I feel great, and I'm doing a number of exercises to strengthen my hip adductors and core. So you feel great because the disc is off the nerve. I also include the cobra on the belly using hands, pelvic tilts, pelvic bridges daily, along with other exercises. So you're making huge efforts, which is why you're feeling great. I just started using the inversion table. Fantastic. Here's the scary bit. I train and ride horses 4 to 5 days a week after work and on weekends. As mentioned, I feel great, no pain, and want to keep moving in the right direction. Can you give me any advice in regard to my posture when riding? The only advice I cannot follow is to stop riding. I must ride. I've been doing so for 45 years and it's my life. Okay, so this is quite a difficult situation, and one I find a lot of people in. How do I do this? I get it, you love your horses, they are your life. But if you want to keep it that way and ride them forever, you need to give your disc time to heal. 6 weeks is not long enough. And the action of horse riding is that you're bumping up and down on the saddle. So as you know, the worst position, well, apart from twisting and lifting, the worst position is sitting for a disc, because you're putting pressure, you're putting the weight of your whole body down through that disc, and as you're sitting, you're squashing the disc like a donut in between great weights. And those of you who watch my videos know that I advise you to alternate between standing and lying and avoid sitting altogether when you're trying to encourage a disc to heal. So from an anatomical point of view, horse riding is not great for a new disc bulge. So when your disc is completely healed, I'll give you advice on your riding position, but right now my advice is to avoid riding, maybe for 3 months. I know that feels like a long time, and I'm sure that's an eternity, but I don't know. I'll just give you the advice, and you do what you like with it. I think you should just focus on strengthening, decompression. The inversion table is great, really, really good. Alternating between standing and lying, even sitting on one of these exercise balls when you're eating your meals, so there's no pressure even while you're eating meals. It's a really hard one. This is the kind of the pain of a disc injury, is that it does interrupt your life, but if you can just take the time needed for it to properly heal to 100%, then you really will you stand a good chance of being pain-free for life. There's no actual reason for a disc to rebulge other than that it's not completely healed in the first place. So there we are, that's my advice. Strengthen up, get flexible, decompress, and of course, my little product plug here, but not really a product plug because this is my fantastic product that I've made for you guys. This is the Soothe Arnica Relief Cream. Now this contains rosemary and bergamot, essential oils which are said to have powerful muscle relaxant effects. It also contains frankincense, which is said to have anti-inflammatory effects. It also contains lavender and wintergreen, which are said to be very powerful anesthetics. Wintergreen is obviously 98% methyl salicylate, which is aspirin, which is why it has that effect. And then, of course, it contains the arnica, which is said to have tissue healing effect and pain relieving effects as well. So you're getting a potential, if the ingredients do what they are purported to say in the research, you get anesthetic, anti-inflammatory, muscle relaxant, which is most important for you with disc injuries, and tissue healing through the muscle tissue healing. So grab yourself a jar of that if you have a disc injury. It will help with the pain. It can potentially help. I'm not allowed to say anything about it. But those ingredients are said to be very effective, so I would recommend you get a jar of that, soothecream.com. Also, those of you who have disc bulges, I highly recommend my 6-week exercise program. I have designed it for people recovering from disc injuries. Please don't start it till you're completely pain-free, because there is a rotation movements through it to keep you mobile. Wait till you're completely pain-free and then start it. It will reactivate your core, it will relax your movement muscles, it will rebalance your back muscles, and it will create that core strength around your disc that you need to support it and encourage its recovery. So let me see. Question here, right? Oh, I've got a live question. How exciting. This is only my second YouTube live, so you have to just bear with me while I'm like a child. Question, Premakuma. Can we reverse a disc bulge and a herniation? I have a problem of herniation, tear and bulge. Your exercise indeed is very helpful to avoid the nerve pinch. Thank you. Absolutely, 100% you can reverse a disc bulge. If you watch my videos on what is a disc bulge, you will see that a disc is like a donut. It's in between the bones. You've got, the vertebrae of the spine. And the disc is like a donut, and you just get a little tear in the disc. And the jelly moves out like this. And when you do those exercises that you see on my YouTube channel, the extension exercises, if your disc has moved backwards, it literally pushes that disc back into the central position. So, but then that tear needs to heal, Prem Kumar. So it's really important, as I've discussed in this live chat, it's really important that you take extreme measures to allow that to happen. So watch my video on how to treat a disc bulge. It tells you what to do, but more importantly, what not to do, because it's often what you're doing activities like sitting for a long time, driving for a long time, lifting and twisting, even lifting the washing basket of clothes and twisting it to the other side. Very, very irritating and a huge strain through the disc there. So hope that helps, but absolutely 100%, I truly believe, no, I don't truly believe, I know you can get complete reversal of a disc. You really do want to avoid a prolapse, which is the next stage of a herniation, where the surface of the disc completely splits and the jelly comes out, surrounds the nerve, and you can't get pain-free. So don't give up. If you have a disc bulge, do not give up. Do everything you can to get it better, because it's 100% possible. And don't let anyone tell you it's not possible. I had one patient who had 5 disc bulges, and she was 50 when I met her, and she was I was training as an osteopath, and she was a GP, and she was telling me her story. She's like, yeah, she said, I had 5. I was like, 5 disc bulges? She said, yeah, I'm completely pain-free now, and she's just a little bit stiff. So what her discs did, what her spine does, it actually fused. Her spine self-fused, so she actually grew bone. This is what she told me anyway. And so the body does stabilize itself. But the key to success is you. and you giving it that chance. The body, in osteopathy we say the body will self-correct given the right environment. So it's giving it the right environment means not putting weight through it, not putting stress through it, and strengthening those muscles to hold it in position. Okay, Exilder, thanks for coming online. Any foods that are not helpful with the healing process? Yeah, so when it comes to diet, we talk about trying to avoid acidic diet, so trying to look at the alkaline diet, because obviously you want to reduce inflammation in the body. So something like aloe vera juice is great for, alkalizing the body. Lots of green vegetables, avoiding processed foods, definitely avoiding sugar really helps, because sugar is said to depress the immune system by 60%. So it's suggested that sugar can suppress your natural functions. I don't know if that's true, but it's said. It certainly does create an acidic environment. Obviously avoiding too much caffeine. So I would say Google anti-inflammatory diets and alkaline enhancing diets. That would be my suggestion. Okay guys, thanks for joining me. It's been an absolute delight. I will be back here next week, I promise, and we will carry on our chat. So have a fantastic evening, and send me in your questions, Coby@soothclinic.com. Let me know what subjects you'd like me to discuss. I guess I'll know that by receiving your questions. All right guys, have a great evening. Lots of love. Bye.